There have been picket lines in Brighton today as junior doctors join colleagues nationwide on their longest strike yet. Today, the government have offered a 6% pay rise, but it falls well short of the 35% phased increase unions are fighting for. Our health correspondent Mark Norman reports.
The first day of the fourth strike by junior doctors, and they're still adamant they deserve a 35% pay rise to make up for more than a decade of lower than inflation pay increases, despite the impact this is having on patients.
Really, we can't go on the way we are. Waiting lists will continue to get longer if junior doctors don't stay in the NHS, if they're not treated with respect and the pay that they deserve. Unfortunately, it's something the government has to solve to drive down these waiting lists.
But this 5-day strike is deeply concerning for hospital managers and the impact it will have on patients, nowhere more so than in emergency departments. I've just spent half an hour in the emergency department here. They didn't want to let cameras in today, but I was shocked at just how busy they are. Every bed, every bay is full. Some bays have 2 or even 3 patients in them. Some patients are in the corridor. Everyone is being cared for, clearly, but they only have 3 consultants on duty. And there are some very clear messages today for us, the public.
So I think this is an incredibly serious situation. Having such a long run of strikes is something that the NHS simply has not faced before. And so I do want to emphasise it's a very serious situation. We will be providing emergency cover for people with the most urgent healthcare needs, but I would very much urge people to use healthcare very wisely over that period.
But of course, the strikes have impacted patients, some of whom are still suffering after appointments were postponed in the last strike.
I wake up every morning in pain, and before I had the operation, when I had the date, I thought, oh, only a few more days and then I won't have this pain, only a few more days. But then when it gets cancelled, it's not only a few more days. It would be weeks. And that's how it makes you feel. You've got no light at the end of the tunnel. You're still in complete darkness.
Scheduled to last for 5 days until 7 a.m. on Tuesday, this strike will be closely followed by 2 days of consultants going out on strike, heaping more pressure on an already overstretched health service.
Well, let's talk to Mark now. He's at the Royal Sussex Hospital in Brighton. Hello, Mark. So we've heard the government's offering this pay rise of 6%. That's not going to cut it, is it?
No, Ellie, I don't think it is. It's such a long way from the 35% they're after. They keep mentioning the fact that they believe for 15 years they've been given below inflation pay increases. To compound the problem, in Scotland, junior doctors have been offered 4.5% this year, but 12.4% in the next financial year. Many junior doctors I spoke to this morning here in Brighton, I think, would seriously consider that if it was on the table, but of course it's not. They're being offered 6%. So that's where we're at, day 1 of a 5-day strike, followed by consultants for 2 days towards the end of next week. And all the while, patients are beginning to suffer. A&E was really quite eye-opening here today, and the advice, once again, is do not use these emergency services unless you absolutely have to during the course of the strike.
Mark, thank you.